My name is Megan. I'm going to be doing the blood administration pass-off video. So I'm going to begin by checking the doctor's order. I'm going to check the blood type and the cross match, and I'm going to make sure that there's a signed consent. Hi Darius, my name is Megan. I'm going to be your nurse today. I'm going to be administering some blood that you lost from your GI bleed. It's just that we're going to be giving blood through your IV, and some of the adverse reactions that could happen is like itchiness, fever, chills, anything out of normal. Just let us know and we can stop the transfusion. Can I just have you verify your name and date of birth? Okay, perfect. And then do you have any allergies to anything? Okay, awesome. So before I begin, I just want to do an assessment on you. I want to check all of your vitals, and I'm going to listen to your lungs. So I just want to check for any fluid overload, if there's any JVD or edema. I can also check your limbs to see if there's any edema. Okay. And then I'd also administer any medications that were ordered pre-transfusion if needed. And then I just want to check the patency of your IV. So this is hand hygiene. And I'm going to get some gloves. You just want to make sure your IV is working good. And also want to make sure that's the correct tubing size, 18 gauge. Okay. I'd actually do it on the other side. That side. Oops, okay. So I would do the same thing, but on the IV side. There we go. Right here. So we would clean that. Check the patency. Yep, seems to be working. There's no stinging or pain with that. Okay, perfect. Okay, I'll be right back. Hi, I'm here for Darius. So his MRN number is 982 541 367. And I've got A positive blood. Okay. And then I've got his consent here too. Awesome. And then I take this. Let's see. Make sure it's the right blood. Is that the W04?
W04
30
17
02
02
98
98
97.
97.
Perfect. So just verify with the second nurse. I'm also going to be looking at the blood, making sure there's no clots or cloudiness. And I want to check the expiration date, 3/28. Okay, perfect. And then I'm going to perform hand hygiene and put on some gloves. Okay, and then I close the curtain, provide patient privacy. Okay, Derek, so I just want to make sure you sign the consent for the blood. We have it here. Just making sure that you don't have any questions or anything before we begin giving you that blood. Okay. Perfect. Just want to second verify. Also, I can check his blood type again. And then you said no allergies. Okay. Just re-verify everything. Okay, and then I just want to make sure that I'm going to start the blood transfusion within 30 minutes. I already assessed vitals within 30 minutes and gave any pre-meds before 30 minutes as well. Okay, here we go. Make sure that's all clean. Just gonna prime my tubing. Make sure there's no air bubbles. Okay, and then I'm gonna fill my filter. Alright, once that is filled, I'm not filling very fast. Let's see. There we go. Okay. Just gonna clamp that. Okay, I'm just gonna clean it. For at least 30 seconds, I want to scrub the hub. Okay. Alright, that's clean. Okay. So I make sure to put it in the right spot. I think I put it in the wrong spot there. It's not coming out. I'll try it one more time. Well, what I do is get another. Get this thing out. It's really in there. Okay, at this point, I'm just gonna verbalize what we're doing here. So I'm gonna slowly release let the blood come 2 liters for the first 15 minutes, and I can adjust as needed. I just want to be assessing the patient for any adverse reactions. If there was any adverse reactions, I would stop the pump immediately, clamp it, and flush with new saline lines, a new saline bag, and new saline line to the patient. And then I would put the blood, give the blood back to the blood bank. And then I would let the provider in the blood bank know. Okay, and then I'm gonna flush with saline, and after the 15 minutes, I'm gonna recheck the patient's vitals and everything. And then once the blood is given, I'm gonna reassess the patient again, listen for the lungs. I'm gonna perform hand hygiene after I'm gonna throw all this in the red biohazard bag, and come back an hour later and assess the patient for any signs or symptoms of adverse reaction, and let him know to let us know if there's any adverse reaction signs too. So, thank you.